So yeah, my name's Izzy. I'm an occupational therapist working at the Royal Marsden Hospital. So I work with cancer patients on treatment, beyond treatment, and at various stages of treatment as well. But there is a common theme of which I am talking about today with Vern, of which is fatigue. So I guess, what is fatigue? Can I, if I can change the slides? Oh, there you go. It's complicated. It isn't necessarily just tiredness. It's not that at all. I think it's incredibly difficult to talk about in the sense because it's so different for everybody. It's different for everybody on different days at different times of day. It's not just needing a good night's sleep, albeit that's important. It is very much a mixture, as you can see here on the screen, of exhaustion, but it can impact it in different ways, such as difficulty concentrating, struggling perhaps with memory, irritability, perhaps more emotional. It's a big mixture, but again, it doesn't mean to say that it is one and not the other. It can be all of it. It can be any of it. It can be different, essentially, at all times. So I wish I could have a quick fix, but I don't. But I just want to start now. It has been spoken about throughout the morning, which is great in my opinion, because it shows how important it is, and it's great that we've got a topic on it today. But what has been emphasised is how much you do need to speak to your local clinicians just to ensure that there is nothing that can be ruled out medically, or whether there's any additional medical support that can be offered. So I would encourage you to ensure that prior to considering solely non-pharmacological sort of management techniques for fatigue, to just ensure that your team are aware, and that they're aware despite the fact you might be trying to self-manage the best you can, just in case there's anything else that they can be checking. And so, what is it? Well, we're going to talk a little bit more about that now. This is what we call the domains of fatigue, or dimensions of fatigue. Now, as I've just mentioned, it's not just physical tiredness. Now, what is physical tiredness? It might be feeling sluggish. It might be achy. Perhaps you might contribute that to certain activities, or you might not. It might be that you just don't feel like you can go as far as you used to, go for as long as you used to. Generally, I say usually that's the most well-known, or what you might think most understood. But actually, as we talk about the others, it might be that these sound familiar, but we've perhaps never associated them directly to fatigue. So sensory, thinking a little bit about all of our senses. So the listening, hearing, and how essentially overwhelming that can be when you're trying to focus on one thing. Now, today is exhausting. I don't know how everybody's feeling, but even in the sort of lunchtime rooms, your rest periods for today aren't necessarily rest. If you think about the conversations, you think about the general noise that is behind you, you're trying to filter through, no matter what conversation or noise, to ensure that you're tuning into the bit that you want to. And your senses are working incredibly hard to filter and pick through essentially what you need to be tuning into. The cognitive side of fatigue. Now, this is an incredibly important one, because I think it is, they're all important actually, but they do have a concentrating, the forgetfulness that actually may well just, you're losing your sense of self and really struggling to feel like you, because that wasn't you before, and why is this happening now? What's happening? The behavioural, so we've got all of these things going on, and it might well be that you prefer to stay in. You don't like to go out so much anymore. You're starting to maybe avoid the plans that you've made, or you're just not making as many plans. Perhaps not seeing family and friends so much, taking on less roles and responsibilities at work. Essentially, you're trying to manage the best you can, but not always knowing that that's sort of the root cause. Affective, so thinking about your emotions, essentially, again mentioning the irritability that it can be, perhaps being more emotional. It can impact everybody really differently, but again, it's that sense of sort of emotional well-being and the impact on that. And the severity, so we've spoken about this already, of how much it changes. So it might change for you day to day, it might change from morning to night, from week to week, month to month. that's sort of hard to predict. It's hard to plan for at all times, but it is definitely something to consider. So when I talk about energy, I guess we're using a battery reference. So what is energy? What energy do we have to use each day? Now, we can use different examples of batteries. I quite like a smartphone analogy because it gives you warnings, doesn't it? Generally, we get a 20% warning when we need to recharge. Now, wouldn't that be lovely if everybody had a warning of when we need to recharge our batteries? We can think of other references like jugs. People also think about, also piggy banks. People like to think about when you've smashed them, we can't put them back together. I think the concept we'll talk a little bit later in this talk about some more resources and how do we recharge these batteries? How do we ensure that we're not going? It might well be that you're not waking up at 100%. We talk about not recharging solely overnight with fatigue, and it might be that you're waking at 75%, maybe as an example, on one day. What we don't want is for you to be at 20% or less than by midday. That would lead me to this sort of circular thing on the right, which is what we often call the boom and bust cycle. Now, I don't know if anybody's heard of that, but it is absolutely generally something we try to avoid, is essentially feeling good. Of course, when you feel good, you want to engage, we want to do, but what might happen then is we overexert and then there's not a lot left to give. It might impact the rest of that day, that actually you're not feeling it, you're feeling flat, you're tired, exhausted, irritable, all of these things, or one of these things, or none of these things. It could also impact for the next couple of days, the next day. It's the impact, I guess, that it has afterwards is why we want to ensure that we don't go all at once, so that we actually ensure that we can spend your energy perhaps a little bit more wisely to ensure that you can be doing more. Now, this is a funny one because exercise and fatigue, generally in the same sentence, are difficult, but research does suggest that exercise does help with fatigue. Whether we like to hear that or not, that is the reality. And I think it is incredibly important to recognise that this will look different to everybody. Whether you are able to achieve 30 minutes per day, that's fantastic. But if not, then that's absolutely okay. Anything is better than nothing. So it doesn't have to be walking or running. It can be swimming, yoga. I think it's the importance of finding something that you do enjoy. Everything is easier when we enjoy it, hey? So you don't always have to force yourself because you have to. I think it's thinking outside the box sometimes of how can we do that in a way that you will enjoy. And alongside exercise, but isn't on the screen here, is that importance of nutrition to ensure that you are having a healthy, balanced diet, because it has such an impact, although we don't feel it. You don't eat an apple and feel fantastic straight away, but it is the build-up effect essentially of good nutrition behind the scenes, let's say, but equally important when we talk about fatigue. So something we call the 5 Ps, which is essentially they are like management techniques and strategies to consider. I'm going to go through them sort of one at a time, but do forgive me if they merge into each other, because that is generally what happens. It's how they all work together. But I will start pacing. So an example might actually be how to pace. How do we pace our activities and energy? If we think about that 30 minutes of activity in one day, that doesn't mean it needs to be done all at once. It might be that we can only manage a 10-minute walk. So we would do that. Ensure that you have appropriate rest, repeat it, perhaps midday, and have that rest again. And then you can get that 10 minutes in the evening. The importance of the sort of short and frequent breaks are key to pacing activity. It doesn't mean activities aren't going to get done. We still like that sense of achievement. Activities do still need to be done, but we are able to do them essentially in different ways sometimes by trying to pace them out. It can be across the day or it can be across the week. To help think about that comes to planning. So how do we know what to do and when to do it? It sounds tiring, I think, sometimes talking about planning, when you just, you have things you need to do and you just get on with it, we just get them done. But actually, we do need to sometimes take it back a little bit and think about how to do them and when to do them. You might notice for you that perhaps showering is exhausting, or the supermarket shop is exhausting. There might just be certain activities that you know each week really are taking it out of you, or you might not. And we might need to spend a little bit of time thinking about that, thinking about where your peaks and troughs of energy might be, and is there anything we can associate with that or recognize? Because then we can think about planning. So think about what is it that we might maybe need to achieve that day, that morning, that afternoon, or within the week. I think it varies. I do know lots of people that like to think of it more broadly in the week. I think that's because there's less work having to think about every day, which I think is fair enough. But also, if we're thinking about a working day, it might well be that we need to plan that working day to ensure that you can manage each working day of the working week. Prioritizing. So important. We need to prioritize everything essentially and know when to delegate. So what is it that you really have to do, or what is it that we can, just give up if we've got the support and to be able to help us? I think with prioritizing, we really need to include your meaningful activities and what do they look like? What are they? Because they are most important in relation to, yes, it might be that there is this big task at work that is on your priority list. Well, that's okay. It might also be that the family dinner is on your priority list because that's what you enjoy. So it's not just the things that essentially have to be done, albeit, yes, they're probably on the list. You need to be able to include and ensure that you're prioritizing the things that mean something to you, that give you a sense of purpose, that put a smile on your face, essentially. It might take time sometimes to work out what that is, or you might be able to tell me straight away what it is that you would prioritize, that you enjoy, whether it be hobbies or what have you. So the importance of recharging your batteries, like we've said, it's not necessarily just sleep, it's not rest. Sometimes we need to think about how else do we recharge? What else is it that makes us happier, essentially? And that is recharging your batteries solely in different ways. Posture might just mean a bit more to some than it might for others, but thinking about your posture. So energy is also spent with what we do physically, me standing, fidgeting. Sorry, I'm a fidget, always am. It might just be thinking about home chores. What is it that you can do sitting down that is going to reserve your energy? Thinking about your posture or positioning, essentially, perhaps at work or whilst you're out and about. So it's a big mixture, but like I say, can impact some more than others. Permission. It's okay to feel fatigued. Like I say, it's common, which is a horrible thing to say, actually, because I think it's not fair. We spoke this morning and all morning essentially about these various things that can contribute to fatigue, but can we know that straight away? No, not often. It takes time. Sometimes we're there, and sometimes we don't get answers to that. It's there, and we are having to essentially think about these management techniques to try to live with it. But we need to recognize it. I say we, I mean you. You need to be able to share with friends and family that actually it's not a good day, and how can they help and how can they support, and recognize when it is that you will need rest. These are just very simple examples that I will sort of flick through in terms of planning. So it looks simple, but actually I know, working with so many people, how much it can change things. So I'll just flick through. I'm getting a little time reminder, which is always helpful. Prioritizing, we've spoken about the meaningful activity and things that are important to you. I guess just quickly on goal setting, nothing is too big. Nothing should feel too big. I think I recognise that activities or things and goals that you'd like to work towards can potentially feel overwhelming and impossible, although they shouldn't. So this is just essentially a bit of a way to think about, okay, what is it that feels impossible, but how can we help break that down? The breaking down goals are really helpful to also give a sense of achievement. We like ticking things off lists generally, and knowing that's working towards something bigger. Now, I'm going to have to fly through this, so just to recognise it as well, the anxiety and stress, and I understand there is another talk, I believe, with some mental health component, but fatigue is significant and can have such a significant impact on the emotional well-being as well. And also the motivation, where does that fit into all of this? I think it's so important to think about, when is it that we just lack motivation because we're so tired of being so tired all the time, and actually nothing feels doable, so it's quite a negative and downhill spiral. So essentially looking after yourself and your mental health is equally as important as the sleep and nutrition and exercise that I've spoken about as well. There are different ways of doing so, and I think a forum like this is fantastic where you can come together, but it might just be talking with family. It might not be talking with family. It might be talking with your key professional at the hospital or someone online or on a phone. It varies for everybody. Adapt thinking, just to comment on that. There's been lots of comments today about a positive approach and positive thinking, and I think that is key, but I think sometimes we do need support to be able to think in that way. Relaxation is an active process. Sometimes we do need to try to switch off or to break that cycle I'm talking about. Now, I think I don't have time to do a calming hand, but this is essentially an example of a relaxation exercise. So if things are feeling a little bit too much, there are various strategies and techniques to think about and to be able to essentially try to wind down. We don't want to waste your energy on negative emotions. It's hard work and not something that is helpful, I guess, in the long term. So thinking about some strategies to utilise is sometimes very helpful. And just know that you are not alone. Again, these settings are helpful to recognise that. And in that poll this morning, Vern and I commented, it went flying, didn't it, up with fatigue. And I think that is another example. If you're not alone, it doesn't make it easier, but hopefully it will know that there are some people to talk to. And I am going to hand over to Vern. Apologies if I've run over time.
Okay, good afternoon, everyone. It's nice to see you all here. I'm going to talk to you about fatigue as well, and this is really from my perspective as a patient and what I've been through, and I was really kind of pleased to see there's some overlap with Izzy's notes, because it would have been a bit worrying if they were completely different, but there you go. So, I'm Vern Middleton. I'm 57. I was diagnosed with WM 4 years ago and treated. I'm an electronics engineer, live on the south coast of England. It always strikes me, I don't know why I say I'm an electronics engineer, because that's like a profession, isn't it? And I'm so much more than that, but I guess it's a kind of old work hangover thing, really. I'm not an expert in fatigue by any stretch of the imagination, but I'm trying to be an expert in mine, which is probably different from yours. But I know we did the thing this morning, the fancy Slido thing, but just for me, would you mind if you've got WM, put your hand up, and then put your hand down if you don't have fatigue? Alrighty. Well, so most of you kept your hands up. I don't know whether you did the same in Amsterdam there, but I think it's obviously a common symptom. So, I haven't put my slides up, have I? I've got more here. Hang on, let me figure this out. It's all right, I'm an electronics engineer. I know what I'm doing. Or was. Where are we there? Okay, so my life before WM, I love the outdoors. That was me, always running, cycling, sailing, doing stuff like that. I'm busy at work, 5 days a week running a business, busy home life, busy social life. Just everything busy, really. WM changes all that to some degree, but let's go through that. I mean, that's my job's mentally intensive. You have to think in detail about everything you're doing during the day. Accuracy is vital, and that kind of thing. I've just mentioned my hobbies here as well. So, I like I'm running, playing the guitar, ukuleles, that kind of thing. I'm just a normal WMer, really. My WM journey is, so I developed pins and needles in about 2016, I guess, and I had tiredness, and I just used to think, I'm 50, never been 50 before. maybe it's something to do with that. And I did the classic thing of just brush it under the carpet and get on with it. And I got more and more tired, more and more pins and needles. And eventually I thought, well, I best do something about this. So I went off to the GP. He did a few neurology tests, really. And I was quickly dispatched off to the hospital. I was treated for peripheral neuropathy first, so I didn't really have a WM diagnosis, and I was treated to IVIG infusions for something called CIDP, which is what they suspected it was. I won't go into that now because I know we're running out of time. So I had regular IVIG infusions, which for about a year, it didn't help. And then I was referred to haematology, bone marrow biopsy, WM diagnosis, DRC within just a few weeks. And it worked, which is good for me. So my symptoms now is 2, peripheral neuropathy, which remains. So I can't feel anything below my shins. So, as I stand here, I can't feel my weight on my feet. So I take gabapentin regularly just to kind of alleviate that. And fatigue. Of the two, fatigue is by far the worst. I can live with pain in my hands and feet. I know that's it. Every day it's the same. I know how to manage it. Fatigue is harder. So if I don't do anything with my fatigue, if I just let it go, then it prevents me from doing all the things that I enjoy, like the running, cycling, and all that kind of stuff. It changes my moods. I get quite grouchy to live with, I should think. I mean, you'll have to ask my wife at the back, and she's probably say I do. It affects my work. I said it has to be kind of detailed and accurate. Well, I can't do that kind of level of detail when I'm fatigued. It's like you concentrate on a problem and it's just constantly moving away from you in the distance, and you can't quite resolve it. It's just there in a cloud. And that's what fatigue feels like to me. There we go. So what does fatigue mean to me? It's not the same as tiredness, and there's a lot of well-meaning people who say things like, just have an early night and you'll be all right tomorrow. That's kind of, it just misses the point. I've gone to bed feeling fatigued, slept for 12 hours, woken up feeling worse. That's not tiredness, is it? If you wake up fatigued, it's nothing to do with sleep. Although sleep does have some part of it, it's not the same. Tiredness makes you yawn and feel sleepy. My fatigue will shut me down. It'll completely immobilise me if I don't look after it. And then, I'm almost comatose, to be honest. I lose track of where I am, who I am, what I'm supposed to do. Then invariably I wake up and my wife's put me to bed and I'm wondering where I am. It's like your head's in a fog. I've just got some little notes here. Sorry, I'm just trying to remind myself. You can't hold a thought. It just goes. I get confused. I can't. If there's more than one conversation going on, I just hear blah blah blah. Probably like what you're hearing now, but that's what it sounds like, and I feel weak. I find it's difficult to stand. It kicks off my peripheral neuropathy. How about that? Something rotten, and I lose my balance, and I'll stumble and fall over, and I've got here speech muddled, which is yeah. Moving on. So bucket. I feels like I've got a bucket of energy, right? And it feels like it gets. Imagine a bucket with a hole in it, and that's your energy, and you fill it. And then it drains away through the day or the week or the year. But you don't know how fast it's going to drain out, and you don't know when it's going to get refilled. And hopefully sleep will work. Sometimes it doesn't. Makes you feel a bit like the Duracell bunny, if you've ever seen that guy on the telly, and he's running around, then his battery goes and he falls flat on his face. So, that's the kind of way it works for me. So fatigue, it's been different through the journey through WM. I mean, before diagnosis, I would be doing something in the garden, which would have been easy, and I would start feeling tired. And I would think, well, like I said, I don't know why that is. Maybe I've been doing too much. But I now know it was probably WM causing it, but I didn't know that at the time. I'd get confused and certain things would be difficult. But again, I just brushed it off. So during early treatment, when I was receiving IVIG, I don't know whether any of you have had that stuff, but it knocks you out, knocked me out. I mean, if I had IVIG, I would sleep, 12, 16 hours. And it was just, it's but is that fatigue? I don't know, possibly. DRC, so during the actual chemo, you get fatigued from that. I mean, the drugs are a scattergun, so they treat the WM, but I think that's been alluded to elsewhere. As I think there's other things get sacrificed along the way, and it's hard work getting through it. After treatment, I mean, I guess chemo still keeps doing its stuff, doesn't it? And it takes a while for it to actually completely clear your system, so you still feel fatigued after that. Now, back in full circle, right? So WM causes fatigue, so I'm right back where I started, but this time I've got a bit of knowledge about the whole thing. So just some thoughts on fatigue, and I'm not a clinician, I don't know very much about all this stuff. It's just what I've thought about as I've gone along the way. Is a lot of the consultants and professionals, if I ask them about fatigue, they'll say things like it's common amongst cancer patients, or we don't really understand why, and just listen to your body, and this kind of stuff. And it's great, they're all well-meaning comments, but they're slightly infuriating comments. And like I said, I'm an engineer, and those kind of answers for me, it's like, no, why don't you understand? Everything's easy. It either works or it doesn't, and that's how my brain works. And it used to drive me potty, but the more I've thought about it, the more I realise that they're kind of good general answers to a fatigue, which is clearly different for everyone. So everyone's going to have it in a different way. And how do you answer that question for each individual? I don't know. So, I always think of fatigue as something that, when you're tired, when you've got a cold or something and you feel tired and you just want to have a lie down and go to bed early or something, and it's probably your brain saying there's something wrong with you, save your energy, go to bed. And in my head, I explain fatigue a bit like that, is your head is aware that there's something not quite right in your body, so it attempts to do the best it can, which is turn you off, and down you go. So it could be right, could be wrong. It's just a theory. So I guess my strategies for dealing with fatigue is, it's like I say, is I kind of decided I was going to try and fix this myself, and I was trying to think, well, what can I do that will improve my quality of life, bearing in mind that I can't get rid of my fatigue. So I kind of came up with a list of things to do, and I'm not suggesting that any of these will work for you, but maybe coming up with a list of things that you think might work and maybe something that's worth trying. So some of these things are a bit random, and some of them may seem contradictory. And I think, as Izzy was alluding to, exercise and fatigue seem contradictory, but maybe they are, maybe they're not. I'm not sure. Sighs of frustration. Look at that one. There you go. So don't worry about the order of these things. They're just the way they poured out of my head. So I love running. I love cycling. I did before WM, and I still do. And I still do it. I still do all the things I used to do. It's strangely, interestingly, not sailing anymore. It's a balance thing. But so for me, exercise is an absolute key thing to do. The benefits of exercise are just unbelievable. Just getting outside, seeing something, doing something. And it's not so much the exercise, it's the, maybe being out in the countryside, seeing an animal or something, or just the enjoyment of running or doing something that seems positive. I think the positive mental attitude is the absolute most important thing with this, and you have to do whatever you can to boost your mental high, if you like. And for me, that's exercise, and it may be something that, as Izzy was alluding to, in some form or other, it'll benefit everyone. But keep active and busy. You know, I think it's easy to... I think I wrote on that one, yeah. I'm going to skip around in the order of these. So I said fatigue causes fatigue. And when I'm fatigued, I don't want to do anything. I just want to sit down. And then I feel more fatigued. And then I get even more fatigued. And it's this vicious circle, which you have to try and break. And you have to do something positive, I find, just to break that cycle. And like I said on there, fight back against fatigue. I mean, I know it sounds a bit dramatic, but it does feel like that sometimes. Is you're like, right, I'm going to go and walk down the road and, you know, get rid of this nasty fatigue and do something. Do something you enjoy every day. It's the same sort of thing, really. Just go out and have some fun and enjoy something. Try and do all the things you used to do, and, you know, before WM. Just be positive about it. I've said listen to your body, but you know, I think you have to listen carefully because, you know, very often I'll listen to my body and it will say, you don't want to do that. You want to sit down, put your feet up and watch the telly. And then I'll go, that's fatigue saying that. So I'll sit down and I'll watch the telly. But if you listen really carefully, it's not telling you that at all, you know. So you just have to be a little careful and make sure you understand what it's saying. I think the positive mental attitude thing, I think you can kind of summarise that as, I have a dog at home, and I have to say, I like to say, be more dog. Because I look at my dog, you know, he sits there and he's just thinking about now. He's not thinking about what he had for breakfast or that kind of dodgy paw he's got. He's thinking about now, and he's living for the moment. And I think that's an important thing to remember, really. Okay, so not all days are going to be up days. You know, you're going to have ups and downs. But that's just the way it is, and I think you just have to accept when they're not up days. It doesn't necessarily make them bad days, they're just not up days. So use them well, you know, just have kind of things you enjoy that are kind of backup activities, if you like. So maybe it's, I don't know, maybe reading a book or anything you like, really, just something that maybe doesn't exhaust you any more than anything else, or just, you know, you can do with that level of fatigue. I think it's important to have a regular sleep pattern. Again, that's been alluded to today. I have to take my glasses off. What are you saying there? Oh, 1 minute. I'm a new glasses wearer, by the way, so I can't see anything here and I can't see anything. Now, where was I? All right, no problem. Yeah, I shall just whistle through these then. So yeah, so down days, use them well. Don't just discard them and get stuck in that fatigue causes fatigue loop. Sleep well, and I go to bed at 10 pretty much every night. And if left alone, I'll sleep for 12 hours. But you know, that's rarely the case. So, limit alcohol consumption. Alcohol causes you to get tired, doesn't it? So it makes sense to try and limit it. Now, I'll say this, limit medication. Now, every medication I've ever taken has always said on the box, may cause drowsiness, right? So, and absolutely, you have to do this with your doctor, is limit what medication you take, because, you know, you want to minimise the risk that medicine is causing you more fatigue. You know, for example, I'm on gabapentin, which is a painkiller, and I racked it up to stop my feet hurting, and then I was so fatigued I couldn't actually move anyway. So I started winding it down again, and I got to a point where I went so low, it was hurting me so much, I was so grouchy, I got really fatigued. So then I wound it back up, and then eventually you find that happy place where you think, okay, I can live with that, let's carry on. And you know, so it's just an example. I mean, the other strange thing is I had anti-sickness medicine which said may cause nausea, which is truly bizarre. Yeah, try everything. You know, I've tried stuff which I would never normally try. So I tried yoga and fell over, so I gave that up. Then I had acupuncture, which wasn't particularly helpful, but the guy who did it was very helpful. He had a lot of knowledge about things, and if you There was a question earlier on about whether you should open up and talk about having WM. I tell anyone who wants to know, really, and because you get feedback back from people, and sometimes it's the most astounding and revealing comments that you'll get from people that will really help you. In fact, I've never had a negative experience by telling anyone. I've probably gone over my 1 minute to go. All right. So, yeah, I mean, the big thing is I would recommend you make a plan. You know, think about your fatigue, make a plan for dealing with it. Try a few different things, see how you get on with them. Amend it often. You know, you may pick some things that just simply don't work, but don't just carry on with them regardless. Remove them from your list of things that may work and go back. I mean, you know, maybe it's the no alcohol thing, and you know, why restrict yourself if you don't have to? So, I think that's really probably, yeah, and you're not alone. Absolutely, you're not alone. I mean, I think that's what your last thing said, wasn't it, Izzy? So, and I've seen that before. I mean, I think we're all there in the same boat, and you can get through it. Yeah, that's it. Thank you very much, everyone, for listening.